Okay, we're back from that short break, and again, thanks Marvin and calling in and giving accolades to our new nurse practitioner, Melanie Lentz, and we're very excited that she's there. And if you're looking for availability and somebody to get in there, she is available. And we are having a little trouble with the phones at the office. We went to a new phone system, and it has been kind of a pain in the you-know-what to try and get in and call. So be patient. If it's cell lines, they do work very well, but for some reason AT&T has given us a royal once-over by not porting the transfer outside. They haven't had a lot of, voice. So, when AT&T has a number for a long time and they have to give it up to another service, they haven't been very helpful. And so that has caused us some grief with the phone service. Anyway, getting back to the discussion that we were having earlier about chemotherapy and the simplest chemotherapy when it comes to just antibiotics to the most complex chemotherapy when it comes to killing cancer has the same basic phenomenon, which is resistant organisms and resistant cancer cells. And so that's why you see remission for some period of time, and then sometimes the tumor does come back, and that is a major problem. And so good healthy living, trying to prevent cancers from developing is really the most important thing in cancer. But remember, nobody lives forever. Trying to get the most out of your day by being healthy. So we got Louis on the phone. Hey, good evening.
Hey Doc, how you doing tonight?
Great. What's up?
Listen, a couple years ago, my cousin had a hip replacement back in Chicago, and everything turned out fine. The hip was fine and everything, but recently he's been having a lot of problems. He's been losing a lot of weight. He's losing muscle. He's got no appetite. He's getting atrophy in his whole body because he's like forcing himself to eat. Now he's been to every doctor, everything, and nobody can seem to find nothing. But the other day when I was watching TV, there was an advertisement from a law firm that said if you had a hip replacement and your system's been poisoned or all this other stuff, please. And I'm thinking to myself, wait a minute. That sounds like my cousin. Have you heard anything about anything like that?
No, not really. But there were, he probably would. They should have given him a card with the type of hip and the manufacturer, so he could call the FDA to see if there's been any problems with that particular brand or manufacturer. And for some reason, if there was, they just lost his name or number and didn't contact him. That would be the first thing. The other thing is that looking at, how old is he?
He's 69.
69. Well, that's still pretty young, really. And I could say if he was 80 years old, the low testosterone and all that stuff might cause muscle mass, loss and weakness. But it almost sounds precancerous to me, Louis. It sounds like a paraneoplastic syndrome where people lose weight, they lose appetite. And I mean, he certainly, hopefully, has been having, colonoscopies and other checks for any other type of cancer that could be developing in him. And it may not be related to the hip. It may be related to some other entity that, the disease process. So
yeah, because he's been telling me that he's thinking about going to Mayo Clinic to have them look at everything. He said because he's gone to so many different doctors, like back in the Chicago area and stuff. And like I said, my cousin's a clean guy. I mean,
okay.
He goes to doctors. He does everything. And this just appeared like maybe a few months back, and all of a sudden he went from perfectly healthy. So all of a sudden, he said he's losing all his muscles, he's losing a lot of weight, he's forcing himself to eat because he's got no appetite. He says he can't figure out what's going on, and all the doctors and the tests that he's been through, they can't find absolutely nothing wrong with him. And I thought that maybe, once I saw this thing on TV where these lawyers brought up something where they said that if you had a hip replacement and they had the phrase like they poisoned your system. Is there something with this hip that could?
Well, there might be a heavy metal in there that chromium and a few other things that might have been used in that area that might have caused a problem. So he needs a heavy metal screen if they didn't do one, and that's why I would call the FDA to see if his particular hip replacement has been an issue. And it's been 2 years since he had the hip replacement?
Yeah, about 2 years, yeah.
Yeah. Does he have trouble speaking, swallowing, other signs of any other neurologic disorder?
No, the only thing that I noticed is he talks like real slow now. You could tell that he's not feeling good. You know how you're talking to a sick guy all the time.
Right.
And when I was talking to him the other day, I said, "My God," I said, "You sound like you're sick. Are you okay?" He said, "No, I'm okay. I'm just weak and stuff." He said that he's losing weight, losing muscle, got no appetite. He said he's got to force himself to eat. And every doctor and every test that he's taken, nobody could find nothing wrong. And like I said, he's talking about, he says, he said, "I'm going to have to go to Mayo Clinic," he said, "and have them look me over because there's definitely something wrong." And like I said, he leads a good, clean life. It's not like he's a street person or nothing. He leads a good, clean life. And this just happened all of a sudden.
Yeah, if he's had a full workup and they can't find anything, that is disturbing. And there are some diseases that we just can't quantify. I have seen people that go through surgery that come out on the other side because of the anesthesia they use, something of that nature, that maybe they develop some neurologic deficit. They may have, some Parkinson's-like illnesses develop and things of that nature. So you do these things and you don't know what the outcome is. But certainly I would check for a heavy metal screen, even though some of these components are surgical stainless, and so there may be some issue in there that he's allergic to.
Okay, thanks very much. That was my question for tonight. Thanks a lot, Doc.
You're welcome, Louis. Thank you. Yeah, most difficult when you see hear a family member just losing that, and he goes to the doctor and there's no answer. Very, very disturbing issue. But I would do a heavy metal screen, and I think the Mayo is probably the right place to go. But here's the sad thing: there are some diseases that we just don't know about yet. They're not that prevalent. They don't really, come out into the forefront. I mean, look at disease like a Zika virus or something like that catches attention. Well, it gets funding and gets things of that nature. One disease that spikes and takes out someone, here and there may not be enough for, science to, to be around long enough to quantify it and to come up with some cure for it. And that's why I was talking about, when I opened the show, before Ray called, I was going to talk about hepatitis C, because I know that I'm having a lot of patients ask about that because they're advertising the new therapy for hepatitis C. And if you're a baby boomer or someone in that generation, to make sure that you ask your doctor to be tested for hepatitis C, so that you can look at getting tested for that. Hepatitis C, again, is another one of those viruses that was probably been around for quite a while. It wasn't until we started seeing, the HIV issue, where we knew hepatitis was around. We called it non-A, non-B hepatitis. Now we call it non-A, non-B, non-C hepatitis. So there's still some forms of hepatitis that are out there that we just don't know. Maybe they call it delta or epsilon. But at least hepatitis C has been found. It probably was transmitted with some blood transfusions early in the 60s and 70s because we couldn't test for it, but we could test for hepatitis B, and hepatitis A is a type of fecal oral route. Somebody unfortunately doesn't wash their hands well enough processing foods, and then they are able to spread that virus onto the next person, especially in the food processing business. Hepatitis B and C are bloodborne pathogens. They have to be transmitted by blood products or other things that are teeming with virus particles, such as some body fluid of some time, usually not saliva. But if you had an open bleeding sore in your mouth, that could very possibly do that. And these viruses, they obviously attack. Now there's a vaccine for hepatitis B, and I encourage everybody to get that vaccine unless you have a specific allergy to it. I mean, you can prevent getting that disease. And I know I just recently worked to help do a program for the Nye County School District to immunize a lot of the teachers for hepatitis B. And it's one of the it's one of those vaccines that's still very reasonably priced and very reasonably available. So there's almost no excuse for people getting hepatitis B vaccine. Now, hepatitis C, there is no vaccine available for that, but there was no cure for it either. There was interferon, there were a few other products out there, but thanks to all the retroviral treatments that were available for HIV, we learned a lot about viral treatments and viral diseases. And we have these new cures now for hepatitis C, which are basically about 99% effective in curing a virus that basically lived in, you either got it and got rid of it, or you have it and it becomes chronic active or chronic persistent. Those patients that have chronic active hepatitis cannot rid the virus at all and are at very high risk of developing the consequences of that, which are liver cancer and cirrhosis of the liver and a very ugly demise. Those with chronic persistent hepatitis have virus particles still present in their blood, and their liver is still fighting it off, but it's very stealth. It's like that fire that just that you burned all night, and you know it just has a little bit of smoke that's coming from it. It's not a lot. It's enough to know that there was a fire there, and that's probably the best analogy I can use for chronic chronic persistent hepatitis C. This is the one where I think that people are at higher risk of being detected for. And we're going to probably go to break here in a few minutes. And when we come back, I'll tell you how we test for hepatitis C and how we try to get rid of it. We'll be right back.